Richard Ogachi. And thank you so much for watching and watching my videos and subscribing, most importantly, at least. So thrilled and so grateful and happy for your support, guys. Each and every person who's watching my videos, I'm so happy and I'm so grateful, and I appreciate you guys so much. I thank you so much for subscribing, and I ask that you watch my videos. I ask that you guys make comments, give me tell me your opinion about my videos, and for sure I'm focused to get better. I'm focused to improve and even record nice good videos, and then also like make the stories more interesting. Thank you so much. And this day I'm here to go ahead and also now, guys, I'm just trying to give preliminary stories about my background as a registered nurse. I've been an RN for the last 16 years, and now I decided to move from Kenya to the US, and it's been eventful 4 years in the US now. I'm getting to, I'm now 5 years in the US, by the way. Unbelievable how time is flying. I don't know where time is going, but so tonight I focused to talk about my practice as a registered nurse in Africa and what I've been able to do in Kenya. It's been a journey and a process of ups and downs and challenges and a lot of failure, and just focusing on at least the areas that have been successful and be able to motivate and influence and get to share these stories so that they can motivate and challenge somebody to also know that they can do all that they want to do in life. So actually, as I had said, I think some of the videos I've talked about my story, and one of the difficult moments and challenges that I've had in my life was to work in West Africa. It was a support for Ebola outbreak in some of the West African countries. And I think I also had said that I have background in public health, and mostly I worked in outpatient clinics. And even during my nursing school, I think we had programs where we did community diagnosis. And I think that's where my passion for community health and community related solutions came from, I think. So when we worked in rural health facilities as students and nursing students, I actually was able to identify there are so many healthcare problems, especially in women and children under the age of 5 years. So at that time, I was able to identify malnutrition as being one of the major problems we have in Kenya, that we have a good percentage of children under the age of 5 years who suffer from malnutrition is significant. And there are different measures that have been put by different organizations that solve nutritional deficiencies and food-related problems. That's including organizations like WFP, World Food Program, Save the Children, and Concern Worldwide. An organization that I worked with, especially when I was facility in charge in government facilities, we did have some kind of flour they give to these kids. And it's been a long time, but we still continue to have cases in the community. So I came up with these innovations to solve malnutrition. When I did my bachelor's degree in nursing, the dissertation and the research that I did for me to be given the Bachelor of Science degree was malnutrition actually. I did an inference on the causes of malnutrition and the numbers and the specific solutions. And then, so I had like explored the different solutions that are given by the other organizations and then came up with my own. That was in 2014. I came up with my own, like an innovation around malnutrition, where we have a program called An Egg a Day. The An Egg a Day program encompasses, just as it says, giving this kind of kids eggs every day on a direct observed therapy, and then we observe in the course of time if they still meet a criteria to be admitted to the program. So we started initially with 20 kids and we administered the eggs. Initially, actually, when we started, we were giving a tray of eggs to every child or their mothers to go home and cook for them the eggs. At least they get to make sure that the kids eat one egg every day for 30 days and then they come back for a supply. So we realized that the kids who were being given eggs to go eat them at home, they would not be given by the mothers for the 30 days consecutively. So we decided to make the program a direct observed therapy where they came to one of our clinics, Gates of Hope, and when they come, the eggs are boiled and they are given. And we realized that after some time, some of the kids really actually got, we could win the kids out of the program faster than the ones we gave the eggs to go eat at home for the whole month. So I think also maybe probably they went home and cooked the eggs and maybe ate them maybe for lunch or dinner, Sometimes that happens when the mothers, maybe they don't have food, they don't have resources to buy food for that day. They may end up cooking the eggs. So this kind of innovation was born to solve malnutrition. So when you look at the landscape of disease distribution for malnutrition in Kenya, we have most of the kids are in low socioeconomic areas. Like in Nairobi, we have areas like Mathare slums and Kibera slums, also like low socioeconomic areas. We realized most of the causes were like people didn't have enough to buy food. So the cases would just sprout in the areas. And then also there was another cause was like poor food preparation practices, where kids are fed on starches and carbohydrates only for a long period of time. So kids end up getting malnutrition disorders from the poor food preparation practices. So our dream is to at least get to serve, at least we target like 500,000 kids, and we are in the process of trying to establish a farm to produce the eggs. We are trying to establish 500,000 chicken farm to produce the eggs to distribute to these kids. And we are looking at the different counties. We are looking at Nairobi County, Kiambu County, and we are targeting in those areas, like low socioeconomic places. And then majorly also our focus will be in Kilifi County and Tana River and Garissa, northeastern counties. That's where most of the kids come from because of like a drought. There is no food. So we'll try to focus on those areas. And then, so what we are looking for is to at least get to give health education around good food preparation practices, and then also support them like with the eggs, like provide available eggs and other nutritional supplements. Like we also have a vision to at least be able to come up with some kind of flour, nutritious flour that we are able to give these kids so that we can intervene in that way. So as a registered nurse, actually, when that problem, I tried to brainstorm on the problem and tried to coin that innovation of an egg a day program. Then we now decided, because the areas that where would we give this kind of eggs, that's how Gates of Hope Nursing Home was born in Kenya. Gates of Hope Nursing Home is a 30-bed maternity hospital that provides delivery services. So far, more than 7,000 women have given birth at Gates of Hope since its opening, and we still continue to grow. I mean, there are challenges around service provision, but we are SHA accredited, and we are giving this kind of services to pregnant women and children under the age of 5 years. So right now we are in the process of starting to offer cesarean section services through like surgery, and then we also like trying to establish and get an ambulance for the facility. We have made a database for community health volunteers. These are people who are from the community, and they are able to identify, and also we train them on health education about the best food preparation practices, and then they go and train the people in the community about good food preparation practices. By and large, we so far have like specific type of community health volunteers. We have a good number that we are working with at the facility, and so far they've helped us get it to reach these kids, and they've done a tremendous job. We support them with stipend, pay them some airtime and transport for those kind of services, and we are usually short of resources, but at least we are trying from our end. Our money towards buying the eggs for the kids, and also provide transport for the community health volunteers. When the time, we usually are able to support them during outreaches. We don't do outreaches every day, but the day that we have mobilized and we are doing outreach, like we have open days when they're going out to teach the public about good food preparation practices, that's when we provide their transport and pay them some stipend for transport from their home to the venue. And such kind of solutions are good, especially in healthcare. So we're looking at innovations, at least expanding on this idea, and then coming up with a solution, a sustainable solution for the malnutrition problem. In fact, also, so growing in that way to solve that kind of a challenge, malnutrition, you know, the effect of malnutrition, especially on the brain, on development. We have standard growths, and we have iron deficiency, anemia, and other malnutrition disorders. So we have different type of support systems. We have the sub-county team that are supporting us a lot with these kind of projects, and also they do like reporting. We do reporting to them. They support on quality assurance and data analysis for decision making. It's been so good and so nice, and we are hoping to grow this facility to a 1,000 bed capacity hospital that is going to be the center of excellency. Because of working and being able to give services in the US, one of the best countries in the world, we anticipate and we have a vision that we'll be able to move back and serve people and be able to provide services to a greater extent. And yeah, and that's the reason why I usually say, if you are to do anything, just start where you are. And that's why I usually, like, you see me bumped up to say that You can be all you can be if you have passion for it. You don't have to be perfect. The facility gets up. It's not like fancy big buildings and good, developed buildings and everything, but the small kind of resources that we have, that's exactly what we are using to influence. We know that this is going to touch somebody, this is going to influence and get to these eggs to these kids, and that we may afford, or we can help them afford a smile on their face, that we can influence in this way, so that we can prevent this kind of malnutrition that affects the kids' brains, and they end up getting their brains not getting developed properly, and they end up messing the kids' life and having the greatest impact on their mental capacity. So we hope that we will be able to do this. We can be all we can be, and this is exactly what I usually mean when I say I want to be all I can be. When you go out as a registered nurse on a long day shift, maybe 12-hour shifts, 16-hour shifts, sometimes most people do extra pickups, you have everything you need. You can be all you can be today. You can influence today. You can create impact today. Do not wait for tomorrow. If you want to be happy today. Go and celebrate yourself. Go and buy yourself something good. If you feel like you want to buy something for yourself, don't wait. Don't postpone to tomorrow. If you have a plan to do something important, and then something that is especially geared towards being for another person, there's nothing that beats kindness, by the way, or being there for somebody else. So this is exactly what we intend to do. And I know that, when I came and I got to the US, and the kind of opportunity that I see and have seen, it's been so good. It's been so nice so far. I've been able to work double long hour shifts, and at least to be able to provide support this facility and to be able to buy these eggs for these kids. We want to buy more eggs. We don't want to see suffering. We don't want to see people who are desperate and they don't have solution for something so simple as malnutrition and provision of eggs. Provide some kind of flour, get them to to understand how to raise their own chickens, get them to understand the best good food preparation practices. This is looking like something small, but it's going a long way. And we hope and we know that this is going to be more influential. And when all is said and done, we will have said that, what? We finished the race. We ran a good race. And that we substantially conquered and were of influence to somebody else. Thank you so much. And, if you're somewhere and you see eggs and people who have those kind of problems, come on, go ahead. But the eggs are cheap and not very expensive. They're readily available. Go ahead and buy an egg for somebody. So, thank you so much, guys. And thank you for subscribing to my YouTube channel. And I know that, this is going to go a long way. Thank you, and God bless you. See you next time.